All right, so I'm going to give you a little overview of inflammation in the body and how anti-inflammatory drugs can be used to treat. So just to go back into your pathophysiology and think of inflammation, I'm sure you probably, from this COVID, you learned a lot about IL-6, interleukin cytokine storm. And words like inflammation has probably been in the market for a long time, in the medical world, I should say. So if we think of our body in terms of the foods that we eat, for example, particularly, fats, if you think of lipids, right? So arachidonic acid, it's a type of saturated fatty acid, which is needed for us for various things. For example, if you eat peanuts or you eat like salmons, a lot of healthy foods have these fatty acids such as arachidonic acid. So our body needs this, and they're kind of like protective mechanisms, and if you look at this arachidonic acid, in this picture here, they say PG, those are prostaglandins. And these prostaglandins are kind of, if you want to think of them as protective, chemicals that help not only in, protection of the gastric mucosa, if you see here, hemostasis, maintaining the blood, coagulation. It helps with pain, inflammation. So, and then also, some of these prostaglandins can also be responsible for cancer. So you see there are so many types of prostaglandins, right? So for the purpose of this class, since we're going to talk about anti-inflammatory drugs, we're going to delve a little bit into the COX-1 and COX-2 aspects of this conversion, where from arachidonic acid it converts to prostaglandins, right? So if you look at the COX-2 inhibitors, more recently they have found COX-3 inhibitors as well. So science is always progressing, particularly in terms of inflammation. So if you think of COX-2, they are selective NSAIDs. So when we say NSAIDs, they are non-steroidal anti-inflammatory drugs. So they're not steroidal like corticosteroids, okay? These are non-steroidal anti-inflammatory drugs. And you could tell just because we reviewed where these can help when we inhibit this COX-2. So by the way, COX-2 is cyclooxygenase enzyme inhibitor. So if you use a COX-2 medication, if you use a selective COX-2 inhibitor drug, such as celecoxib or rofecoxib, what can happen is, of course, it will help with, improving pain and inflammation, but it could cause problems with gastric mucosa. So, because they're selectively affecting, I'm not expecting you to know any like further other than just generally think of COX-2 and then think of COX-1, right? So if you think of COX-1, those are these medications such as ibuprofen, naproxen, and they're not selective. So they're generally affecting all of these areas, okay? But if you think of COX-2, they're very specific, selective, okay? So more recently, there are recent studies to show that celecoxib was causing, potential cardiac damage and also GI bleeds to some patients in some studies. So I think it had a black box warning about almost 10 years ago now. So not very commonly prescribed. I don't even know if it's still available in the market, but the other non-selective ones, the ibuprofen and the naproxen, they're more general. So, like for example, right? If you have a fever or if you have pain, if you have some swelling, we just go to the counter and get ibuprofen or, Aleve or Advil, right? We just ask for Aleve or Advil, and that contains ibuprofen. So those are very effective, not only when we have pain or fever. And if you think of naproxen, there's always research continuously being done, and studies are showing that naproxen is even more protective on the heart compared to other, like and the kidneys as well compared to ibuprofen. So if let's say a patient has arthritis, right, and they take a leave over the counter or Advil, it's not recommended for patients, particularly older patients or anyone who has problems with heart or renal problems, to take these for long periods of time, even with also with GI, right? So if you want to think in terms of you as a nurse, if you're going to, give patients ibuprofen, naproxen, Zocdoc, certain things that you have to keep in mind are why are you giving it, right? And how long have they taken it? The recommendations are not to like take it for continuously for more than 2-3 months as of now. So things can keep changing, right? So this is the basis of how the prostaglandins are affected through their arachidonic acid. But just to like put it in this perspective of the whole body, right? So I'm going to tell, if you remember from your analgesics that we did, the opioid analgesics, we talked about prostaglandins being released at the site of the injury, right? So in order to inhibit those prostaglandins, we apply, patches, or we, pain patches are available, like diclofenac is the Voltaren, gel or patch that's available. So you can just place it on the skin or wherever there's injury. Let's say there's swelling, right? Let's say there's knee pain, right? Knee swelling, and you could apply the diclofenac patch or the Voltaren, gel that's available on that area. Of course, when it's open, you won't wear those, right? Put those. So when you place it there, what happens is they inhibit the prostaglandin synthesis, and that's why they help with pain relief and inflammation relief. We didn't talk about aspirin or acetaminophen here, but acetaminophen is also an NSAID, but that's more specific to fever, as you know, for body temperature, right? Like to decreasing the body temperature. We'll talk about that in the